Hello everyone. So today we have another topic, that is levels of clinical significance. It's a very simple topic, yet I have noticed that many people struggle to get their way around this topic or wrap their head around this topic. So we'll take it in a very simple manner. Again, we'll use mind maps here to understand this topic. Okay, so first we have to understand what do we mean by clinical significance here. Then we'll see what are these levels that we are talking about. So clinical significance basically means, as the name suggests, that is anything which is significant clinically and you can appreciate it clinically, as in by using clinical methods, or you can say your instruments or RVGs. Okay, so basically in a clinic which can be observed or appreciated, you can say that it is clinically significant. Okay, now this is very important from a dental perspective or point of view, especially when we've been talking about periodontology. This is a very important topic. Now, coming to clinically significant part, again, anything that is clinically significant can be of, we can basically divide into two types. Okay, first thing is nature of the benefit. Nature of the benefit, that is tangible or intangible. Tangible basically means that you can clinically or meaningfully, you can appreciate it. So these are patient reported outcome measures, okay, as in the patient can appreciate it. So these are capable of being precisely identified and realized by the mind. Your mind can see it, your eyes can see it and appreciate. For example, if a patient came with bleeding gums and you prescribed some sort of medications, okay, you went for scaling, then you prescribed vitamin C medication and the bleeding stopped, or eventually the bleeding reduced. Now this is clinically significant and clinically relevant also, and also it is tangible because your brain or patient's brain or mind can see it, can appreciate it. Then reduce tooth loss, or for example, if a patient's tooth was mobile, now after treatment it is non-mobile, then yeah, it was a tangible benefit. Then abscess elimination. Abscess is, your patient can appreciate it, your patient can feel the pain, they can also see the abscess because it's a swelling, right? So once you relieve the patient from abscess, this is also a tangible benefit. Or again, so tangible is basically means that your patient can appreciate it with their eyes, your patient understands it. Okay, then coming to intangible one. So intangible is something that cannot be realized by the mind, cannot be identified by the mind. Now for example, we have probing pocket depth. Probing pocket depth you measure with a probe. Okay, you can appreciate it, but the patient cannot. The patient does not know what a probe is. The patient does not know what a probing pocket depth is. To the patient, honestly, it does not even matter whether the pocket depth is low or pocket depth is high. What matters for the patient is that the bleeding should stop. He should be able to eat properly. There should not be any smell or halitosis. Okay, now why it is happening, it's not his concern, it's your concern. And you have to remove the etiology in order to get results. So probing pocket depth is again an intangible benefit. Then enamel mineralization, or for example post fluoride also, enamel mineralization, it's intangible. The patient cannot see it or appreciate it. Yes, there will be less caries reduction, less amount of caries, that is, there will be increased caries reduction. This could be a tangible benefit, but again, enamel mineralization, this process is intangible. Then decreased periapical radiolucency. This again is only appreciated on an RVG. The patient does not understand RVG. Patient cannot appreciate an RVG because they can't read it. You can. Now this is also an intangible. So I hope you understand what is tangible and what is intangible. Tangible is basically the patient can appreciate it. It can be realized by the mind. Okay, and intangible is the one which cannot be realized by the mind. Simple. Now, size of the treatment effect. So size of the treatment effect also matters. If for example, like you started using a certain mouthwash, okay, there is reduction in plaque, but it's so small that you can't even measure it. Okay, so this size is small. Again, now, for example, another treatment we can talk about. So you can say GA, generalized anesthesia. Now this is so large, as in it's all or none. Either the patient will get induced or will not get induced. You don't have to conduct long-term RCTs or cohort studies to find out the effect of general anesthesia on patient, right? It is tangible, you can see it. Then, yeah, so this is large effect. Small is, it's very small. You need large RCTs. For example, localized drug delivery. For localized drug delivery, it's not all or none. Sometimes it might work, sometimes it not. Okay, now to find out how effective this is, you need to conduct long-term RCTs. Okay, so this is about the size of the treatment effect. Now, clinically significant, we saw two types: nature of the benefit and then size of the treatment effect. Nature, tangible, intangible. Size could be large or small. Now, moving on to levels. So, levels basically level 1, level 2, level 3, level 4. Level 1 is of the highest quality. So here we are talking about magic bullets, as in miracle cures, such as vitamin C for scurvy. Then we have bone marrow transplantation for leukemia. So these were miracle cures. Okay, this means tangible plus large. So we are talking about something which the patient can see and which is all or none, as in it will work no matter what. You cannot ignore it. Okay, so these come under level clinical significance level number 1. Then coming to level 2, so these are tangible benefits, but they are very small. Okay, so the likelihood of obtaining benefit is also very small. You need to conduct RCTs in order to realize them. Then we have large but intangible. For example, highly active antiretroviral therapy for AIDS. It is large, it worked, it eliminated AIDS or reduced the morbidity, but it is intangible, as in the patient cannot see the antiretroviral drug killing the virus, right? So this comes under level 3. Now level 4 is small but intangible benefits, as in these work but on a very small scale and the patient cannot appreciate it. So you need well conducted RCTs to find out how effectively they work. Okay, most of the clinical trials in dentistry per se, periodontology, if you talk about, they come under level 4, as in the benefits are also small and also they are intangible. Like for example, if we are trying to find out ICTP, that is it's a particular compound, or you can say it's a breakdown compound which is formed after collagen degradation. Now if it's increased, it means there is more of gingival breakdown, more of periodontal breakdown. So this is very small. You need to conduct well planned RCTs and you need some sophisticated methods to identify and calculate it. And also it's intangible. The patient cannot appreciate it. So these are some examples. Okay, I hope you all understood. Now please, if there is any particular topic that you want me to cover using these mind maps, do let me know.